Let us understand the differential diagnosis of a patient presenting with acute red eye in orbital pathologies. There are five important differential diagnoses. The first is the active thyroid eye disease, which is the most common. The second is going to be cavernous sinus thrombosis. The third is the keratico-cavernous fistula. Always look for these very characteristic corkscrew vessels in these patients. The fourth is going to be much commonly seen in kids, especially, which is the orbital cellulitis. And the last is going to be orbital trauma, especially when there is going to be a retrobulbar hemorrhage. So please understand these five differential diagnoses for an acute red eye in an orbital pathologies. So all these patients will have some common features. For example, these patients will have proptosis or bulging of the eyeball since orbit is involved. And because of the compression on the optic nerve, patients will lose their vision, so they will have RAPD or relative afferent pupillary defect. Also, these patients' extraocular movements would be restricted, therefore leading on to diplopia. And also understand that these patients, MRI or a neuroimaging is going to be mandatory.